It's time for Morton in the Morning on WVBF, a weekly get-together with your friends at Morton Hospital. Coming to you every Wednesday at 11:05 a.m., Morton in the Morning brings you full access to the latest hospital news and health information. Stay in the know about important health and wellness topics, new doctors and services, and upcoming events. And get to know the team at your community hospital. And now, Morton in the Morning.
Good morning, everyone, and welcome to today's Morton in the Morning show. We are happy to be joining you right here from your community hospital, Morton Hospital in Taunton. And we have some exciting news to share with you today. Over the past several months, Morton Hospital has been planning and building and renovating a unit here at the hospital to become a new substance use disorder treatment unit. And we are so excited to announce that just this week, our new unit called MORCAP has officially opened in our community. So we want to take advantage of the opportunity to provide you with some more details about that unit. So MORCAP stands for Morton's Comprehensive Addiction Program. And what that is it's a level 4, which is the highest level of substance use disorder treatment inpatient care. It's a level 4, 32-bed substance use disorder treatment unit, providing the most intensive level of SUD care for patients experiencing severe withdrawal symptoms or medical issues associated with substance addiction. So we have our unit staffed by doctors, nurses, counselors, behavioral specialists, social workers, and they will all work together to assess each patient's degree of dependence, address any underlying medical and psychological conditions, and develop a personalized recovery plan. So along with that inpatient program, and that was actually renovated up on the 3rd floor of the hospital where we formerly had some administrative offices, which fortunately we were able to find some space for and move those so that we could renovate this new unit. Along with the inpatient unit, our program includes an intensive outpatient program for continuum of care. So the outpatient program is available to anyone who qualifies that may not qualify for inpatient care, or it's also available to patients who have had that inpatient stay on our new unit and want to continue to their journey to recovery. And those programs, we have a variety of interventions and therapies. So we will be offering individual psychotherapy, group therapy sessions, pharmacotherapy, which is also known as medication treatment programs, referrals to other medical or psychiatric programs, introductions to self-help groups like AA, NA, Al-Anon, and Smart Recovery, and also psychiatric consultations through our psychiatry team here at Morton Hospital. So again, I mentioned that we have officially partially opened that unit. Right now we are phasing the opening of the unit and starting with a partial opening as we continue to recruit more staff to staff our new unit. Fortunately, we already have some great team members. We have a new medical director for our unit, Dr. Patricia DeLima, who is absolutely wonderful, and she is so passionate about addiction medicine and helping those struggling with addiction needs. And we also were fortunate to have some staff come and join us from the former MORCAP program, which was in Foxborough. That was a level 3.7 facility, and now that is closing, and we are opening our 4.0 level 4 facility here at Morton Hospital that will be able to care for any patients level 3.7, level 4 who are experiencing severe medical or psychological issues associated with their addiction. So last week we were so honored to host a ribbon cutting event for the unit, and we invited many special guests to join us. We had our board of directors, we had our medical staff members, we had some of our members of our corporate team at Steward Healthcare, and we also invited several local and state elected officials who joined us for the event. We were honored to have DPH Commissioner Margaret Cook, Senator Mark Pacheco, State Representative Carol Doherty, our very own Mayor of Taunton, Shauna O'Connell, and several members of our City Council. And we had a wonderful event. They were able to come and see the unit. We had some special guest speakers and some tours of the unit. And we are just so excited to finally be able to offer this program to our community. It's so needed. We have a high incidence rate of substance use here in the Taunton area, and now with this new unit, the inpatient unit and the outpatient program, our patients will be able to receive that care locally, close to home and close to where they'll have the best support from their family and friends. So in light of our official soft opening of our new unit, again called MORCAP, we thought we would take you back to an interview that we had back in the summertime where we interviewed our Chief Operating Officer, Nancy Spirko, and our Senior Director of Facilities and Operations, Tom Magliochetti, and they were talking about the MORCAP unit in greater detail and about the whole construction process. So we'll give you a look back today at what that planning looked like and also provide you with some additional details about the MORCAP unit. So please listen in about our brand new unit here at Morton Hospital MORCAP. And before we jump into our interviews, you can find more information about MORCAP on our website, mortonhospital.org, and click on the services page. And we also have a couple of phone numbers. So the phone number for our inpatient unit, our MORCAP inpatient unit, is 508-967-3200. And then the phone number for the intensive outpatient program is 508-967-3838. So please feel free to check out the website or call if you need information, if you know somebody who is looking for treatment. One of our counselors or liaisons would be happy to help you. So again, we're going to jump back to an interview that we had in June where our Chief Operating Officer, Nancy Spirko, gave us some more in-depth information about the unit. But first, we are going to take a little break, so please stay with us if you want to learn more about our new MORCAP unit at Morton Hospital. Before we break, just a reminder how you can contact us here at Morton in the Morning. You can email us anytime at mortoninthemorning@steward.org. That's MORTON in the morning at STEWARD.org. And we would love to hear from our listeners, any feedback you have, any suggestions for future shows. So stay tuned. We'll be right back after this break with more about our new MORCAP substance use disorder treatment unit here at Morton Hospital.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
If you're looking for weight loss that lasts, look no further than the Steward Center for Weight Control at Morton Hospital. Our program was recently nationally accredited, and we offer both medical and surgical weight loss options, as well as free support programs, all right here in Taunton. If you've struggled to lose weight, it may be time to consider weight loss surgery. Call our Center for Weight Control at 508-301-2434 to book a consultation.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning, everyone, and welcome back to today's Morton in the Morning show. If you're just tuning in, we have announced that Morton Hospital has officially done a soft opening of our new MORCAP substance use disorder treatment unit here at Morton Hospital, which we are very, very excited about. And for today's show, we are taking a look back at an interview we had with our Chief Operating Officer, Nancy Spirko, to tell us a little bit more about that unit and the patients that it will treat and what types of programs we will offer. So let's dive right into the interview. So our first interview today is with Nancy Spirko, who is the Chief Operating Officer here at Morton Hospital. So Nancy, thank you so much for being here. We have an exciting show.
My pleasure. Thank you for having me.
So why don't you start by telling us about yourself, maybe a little bit about your role here at Morton and some of your background.
Sure. Like Julie said, my name is Nancy Spirko. I'm the Chief Operating Officer here at Morton. I joined the Morton family in October of 2019. Prior to that, I've been with Stewart Healthcare for 10 years. I started at Good Sam in, January of 2000, December of 2010, January 2011, somewhere around there. I originally came as a interim director of peri-op services and decided to stay on full-time in July of 2011 and was at Good Sam overseeing their peri-op services until I joined Morton in October of 2019. My role here, I have multiple departments that report to me. Peri-op services does continue to report to me. I have the lab, radiology, respiratory. I work very closely with facilities and environmental services. So I have a good portion of the building reporting to me.
Yes, we wear many hats for
Yes.
sure. And it feels like you've been part of our team for longer than, you're not even 2 years yet, but it feels like you've been here for quite some time. So today we're talking about some of the exciting construction projects and the growth that we're experiencing here at Morton. So in your role as Chief Operating Officer, how involved do you get in terms of planning and preparation for new service lines when they're brought into Morton Hospital?
Usually I'm at the ground up. I'm a very hands-on type of person. I'm a very visual person. So for all the projects, construction projects, I like to actually work very closely with our CREF partners, which is our real estate group that comes in and helps us on all our projects. I attend all the construction meetings. Wednesday is our construction day, so we start at 9 o'clock and we have construction meeting for the MORCAP unit, followed by the PACU roofing. Prior to that, we did the air handler that we just put up on the OR, on the roof for the operating room. So I participate in all those meetings. I believe in walking the sites, more so for my education, so I actually understand the project. I think that helps. And then as a clinical resource, because I am a nurse by my background, I am a nurse. So from when they need clinical support or we need to look at a clinical area to see what we have to do to make sure we mitigate any issues, I also can be a clinical resource.
Okay, great. So we've actually had a lot of growth here at Morton over the past few years, and you mentioned MORCAP. So that is actually the new unit that we're currently constructing on the third floor of the hospital. Really exciting. It's a much needed service in our community. So let's talk a bit about that, if you can tell our listeners what MORCAP is.
So MORCAP is going to be our 32-bed substance use abuse program. And this program is going to help people who need to detox either from alcohol or drugs, but need to have their medical problems such as high blood pressure, diabetes, managed as well. Right now we have some of these patients coming through our emergency room, and they get admitted to our med-surg floor. And we do a very good job of handling any of their medical problems. But they're not getting any treatment for their addiction because we don't offer that service currently now. Once this floor MORCAP opens, we will admit these patients to this unit. We will have someone to oversee their medical problems, a physician. We will have 24/7 coverage by either a nurse practitioner or PA. And in addition to, we're going to have counselors and an addiction medicine physician overseeing the program to help us manage their addiction as well as their medical. Once their length of stay, I believe, is usually between 3.7 to 4 days. Once they're ready for discharge, our plan is to also have an intensive outpatient program offered to them that will be part of Morton Hospital. We're still working out the location. We think it's pretty much going to be adjacent to that third floor.
Okay.
But once they're ready to be discharged, then we will hand them over to the outpatient treatment program. And what we do why they're here on the inpatient side is we will bring them over to so they can see what the outpatient treatment plan looks like. It also works that they'll know, a lot of the staff go back and forth between inpatient and outpatient, so they'll know some of the staff. So that gives them a certain level of comfort. There's some relationships have now already been developed. So to transition them to the outpatient program usually really helps them, and it prevents that revolving door of them coming back to the emergency room because they've actually gone back to whatever their drug of choice is.
Okay. And I understand this unit is going to be a level 4 unit. What does that mean? What are the various levels?
So there are various levels to this. We currently have in Foxborough our MORCAP, which is a 3.7. And what that means, so if someone even needs an intravenous put in, they have to be shipped over to Good Sam. So the difference between a 3.7 and a 4.0 is the amount of the type of care we can give them.
Okay.
So if they, here we'll be able to start an IV, we'll be able to manage their diabetes, we'll be able to manage their high blood pressure. Right now at a 3.7, that can't be done. They have to be shipped to a medical program.
Okay. And will patients be able to self-refer to our unit, or will it require them coming through the emergency department or a provider referral to the program? How will that work?
So anybody, we can get patients several ways. We can get them through the emergency room, from our own emergency room. We can get them transferred over from another sister hospital, or even like say a Sturdy hospital can send us somebody. And we do have patients that can actually walk in. And all the patients on arrival are assessed by a triage clinician to determine if they meet the level of need for this hospital. So not everybody that wants to go through withdrawal or is in withdrawal meets the needs. There has to be a medical component to as well.
Okay.
But we do have a lot of support groups and other places that we can always refer the patient to. And if they don't meet inpatient level need, we can also, and only meet outpatient, we can get them into our outpatient program. So you don't need to start our inpatient to go to our outpatient. We can take anybody into our outpatient program.
That's great. So the program is really sort of like a two-pronged approach, inpatient and outpatient, and we really don't have a lot of those resources right now in the community. So
very little.
So I understand that, we've been talking about this out in the community a little bit with many of our community partners who currently work closely with our, for example, behavioral health navigators and our crisis workers in an emergency department. And the community, our community partners are really excited about this because they recognize there's such a need. So why is this going to be so important for our community?
Because right now, folks have no place to go. There is only 172 level 4 beds in the state of Massachusetts, and none west of the Mass Pike down this way. So all the way down to Cape Cod, there are no beds for these patients. So when you think about the population in Massachusetts, when you think about the amount of people that are suffering from addiction, and only to have 172 beds in the hospital, in the state, that's not very many beds. We do have a level 4 up in our sister hospital in St. Elizabeth's. Again, their volume, I think, is probably between 15 and 20. So again, not a lot of beds up there in that area for our system.
From the convenience perspective alone, I think that's going to be really important, especially for families who want to support that individual who's going through treatment versus, driving into Boston. It's now going to be right here in our community. And 32 beds is actually a lot when you say we only have 172 to start with. That's a good chunk being added for this area. So that sounds really important. So construction is happening right now. I mean, even as we sit here, I can hear a little bit of drilling above head. So what step of the process are we in right now in terms of construction?
Actually, we are in the final stages of demolition.
Wow, okay.
One section of the floor, actually, I believe they started doing some framing on. We have some additional plumbing work that we have to do on the ceilings on the second floor for plumbing for the third floor. That's ongoing as we speak. There's, there's like 6 or 7 areas on the second floor we have to actually work in the ceiling for plumbing. So we're moving along. Our goal is hopefully to be open by mid-September. So we're pretty much on track from the construction piece.
Okay. So you mentioned demolition. So what comes after that piece? They start actually building walls,
framing and building walls, and there's a couple things that have to be done with the electricity. So they will be taking place probably early August. We have some work being done with med gases that we're looking to take care of next week. As far as I know, to my knowledge, best of my knowledge today, we are on target for construction.
Okay, great. So it's a pretty large unit, actually. You mentioned a couple of the key team members who will be involved in the care of patients up there. Who else? I know that we're currently recruiting for certain positions like medical director. What other positions will staff this unit?
So you'll have your medical director, which we have. Dr. DeLima is our medical director. She will be joining us actually in August. We are still recruiting for one more medical director to help oversee the outpatient clinic. But the other types of resources that you have, like I said, you'll have at either an NP or PA 24/7. And I know we've recruited, I don't know, one or two, I believe. And I know we're still in the recruitment phase of that. We will have nurses. We will have counselors. You will have a triage evaluator. You will have mental health associates that will be up there to help the patients. Case management. Your unit coordinators, those type of positions.
Okay.
But that's about rounds it out.
Okay, so quite a lot of people that we were recruiting for. We actually just recently had a hiring event at the hospital, but those positions weren't even part of that yet. So I know that those will be posted somewhat soon on our website, and we'll be actively recruiting if anybody has an interest in that type of patient care.
And we're hoping that a lot of our employees from MORCAP will come to work here as well.
Great. So, final question. So substance use disorders and mental health are so connected. So will there be a mental health component to this program, or will the staff work closely with our existing psychiatry team?
So our psychiatrists will definitely be available for consult. If they need to have that component for their care, we will consult one of our psychiatrists to come and meet with those patients.
And on the outpatient side, will they be referrals to counselors, or will they be part of that program?
They will be part. There will be counselors over there. Again, we want to have a medical director. We want to have what they call a MAT, which is a medicine assisted treatment program. So there's. And believe me, I've learned so much since I started this program, working on this program, that there's medications that patients can be given to help them go through detox. They don't have to do it cold turkey. There's medications that they can be given. There's medications that they can be maintained on to help prevent them falling back into a relapse.
Okay. Anything else we missed that the community should know about this unit that will be opening?
I don't think so. I think it's going to be very successful. And when I say successful, I think we are initially starting open with 20 beds, but I think we'll be ramped up to the 32, which I say successful, but kind of not successful, if you know what I mean.
Absolutely.
It's unfortunate that this is such a need in many communities, not just Taunton, but at least we're going to have the beds to help the patients and the community members here in Taunton that have addiction problems.
Absolutely, much needed, especially with our incidence rates of substance abuse here in the area. I mean, in my role, I work on community benefits, and we're constantly looking at those stats, which have always been pretty high for this area. So we are really looking forward to it, and hopefully our community is just as excited about this unit as we are. So Nancy, thank you so much for telling us a bit more about it. And if people have, any questions, they can reach out to us. I will share at the end of this segment the email address to contact us here at Morton in the Morning if you have any follow-up questions. So thanks again, Nancy. We appreciate you being here.
Thank you for having me.
All right, well, that was a look back at an interview that we had in June with Nancy about the MORCAP unit, which was being renovated and constructed at the time, but as you now know, is officially open here at Morton Hospital. We are going to get ready to take another break, and when we return, we will replay another interview with our Senior Director of Facilities and Operations, Tom, who will talk a little bit more about the unit and the construction from the facilities standpoint and some of the other projects we have going on here at the hospital. Before we break and take our halfway show pause, I wanted to share some additional great news. So that is, that we've been talking about the 2021 Best of the Best Community Choice Awards contest here on the show for the last few months as the nomination and voting period has gone on. And we are so thrilled and proud and honored to announce that Morton Hospital was voted number one in 5 different categories for that contest. Best Hospital, Best Audiologist, Best Hearing Aid Center, Best Physical Therapy, and Best Weight Loss Center. So we are thrilled. We want to thank everyone for voting, and you'll see more information about that contest and our wins in each of those categories on our Facebook page, on our website, and more. So thank you to everybody. We are so proud to be voted the 2021 Best Hospital. We're going to take another short break, and we'll be right back after this brief message.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
Experiencing gastrointestinal issues? We can help. Morton Hospital and Steward Medical Group have opened the new Steward Digestive Disease Center of Taunton. Dr. Alexis Pappas and physician assistant Amber Lippa specialize in treating a wide range of GI issues and are now accepting new patients in their office conveniently located in the Thayer Building at Morton Hospital. To request an appointment, call 508-828-7740.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning, everyone, and welcome back to Morton in the Morning. This is the second half of today's show, and we are taking a look back at some interviews that we held as we were building our new MORCAP substance use disorder treatment unit, which is now open at Morton Hospital. So we are going to dive in with a flashback to our interview with Tom of our facilities team. So next we are here to interview Tom Magliocchetti, who is our Senior Director of Facilities and Operations here at Morton Hospital. Hi, Tom. How are you?
Good. Great.
Thanks for being here today. So tell us, big title, tell us about yourself and your background.
Yeah. So as Senior Director of Facilities Operations at Morton Hospital, that role really ensures that the hospital is maintained properly, that it meets fire codes and other safety codes. And it's a key role in any healthcare facility because you have large populations of patients that wouldn't be able to move quickly in emergency situations. And certainly we want to maintain the hospital with the aesthetics and nice environment of care that patients want to come to.
Absolutely. We have a big space to cover, especially with, our expansion a few years ago with the emergency department. It made the actual facility even larger.
Yeah. So one of the things that is interesting is I've worked in several organizations, healthcare organizations. I'm proud to spend a great span of my career in major health systems in New England, and really proud to work at Steward Morton Hospital. And as far as the construction activities that are going on at the hospital, it's really vital that hospitals keep up with their facilities to make sure that they have contemporary facilities where they can provide great care, services and care in a safe manner.
Absolutely. And so I know, how long have you been at Morton? First, let's ask that.
Yeah, I came here at the end of 2019.
Okay.
And I came here when I was working pretty much full-time as a consultant with Joint Commission Resources.
Yeah.
And it's a part of the organization that really works hard to come into hospitals and survey them and make sure that they're safe, the medical care is great, and operationally effective. So at that time, there was a need here at Morton Hospital. And I had worked in a hospital recently, and then years ago, St. Elizabeth's Medical Center. So I had relationships with people in the corporate office. And I just came in to support Morton for a period of time, and I was so impressed by our president, Heidi Taylor, when I met her. And I said, this is a great forward-moving organization. in working with the facility staff, they're just really talented people.
Absolutely.
And so I was very happy to really stay on because it was a good fit.
You have a great team, and it was interesting. I was interviewing Nancy earlier in the show, and it sounds like she started around the same time as you, because she started in October of 2019, and I said, it feels like you've both been part of our team for so much longer. Yeah. That's a good thing. It's just because you integrated so well into the organization,
Yeah.
I think.
Yeah, well, I built upon my past experiences, and again, when I took one look at Morton and realized this is the place to be.
Awesome. Well, we're happy to have you here. And as you mentioned, a lot of construction activity. There's some really exciting projects going on, so let's talk a bit about those. So right now, actually, and over the past couple of weeks, as patients and visitors and community members have driven by the hospital, they may have seen a large crane outside. So what's that all about?
So the crane is to replace the roof area around a project that we did not too long ago. We had replaced the air handler for the surgical services areas, and I got to say, we have one of the most sophisticated, contemporary air handling systems. What it really comes down to when you hear the word air handler, it's the ventilation system to make sure that the air is filtered properly and warm enough and cool enough when the demands meet. And it was a pretty significant air handler. It's one of the largest air handlers I've seen replaced because it covers such a large area, and I think it demonstrates Steward Morton's commitment to making sure that we have contemporary tools. There's so much technology change that goes on, and I feel very comfortable about that. The crane is here now to go back and replace the roof area around the air handler.
Okay. And now the air handler, I know that it's especially important to have a sophisticated system for the area of the OR and day surgery. So why is that?
Well, to support the environment of care for surgery, the air has to be filtered. It has to be the right pressure. Standards have changed in recent years in a direction that we all would like, and so the what they call it in standards is appropriate air pressure relationships and humidity and temperature, and that all goes into keeping any potential infections to the lowest possible levels. So we employed all of the modern technology that you see in many of the electronics devices you utilize. So now that's incorporated in our medical equipment, and that was a multi-month project, and it was so great. Nancy, as a clinical leader, was such a collaborative team member, and I can say that when things are built here at the hospital, it really is an input between facilities people and clinical people.
Absolutely. There's a lot of collaboration, a lot of people involved for sure. So we replaced the air handler. Now we're working on the roof. Earlier we talked to Nancy about MORCAP, which is a huge construction project we have going up on the third floor of the hospital. And I want to hear more from your perspective, from the construction and facilities perspective. So walk us through what's happening up on the third floor right now, and how long has that been going on? How long will it go on for? What step are we in?
So we're getting pretty close to completing that unit. It was months in the planning, and our health system, in its efforts to support the needs of the community, recognized the needs for patients with substance issues. And it's so much science, modern science, that goes into treating that illness that so many Americans have suffered from and continue to. So as part of that, there's the early stages of a patient getting well is going to a safe area where they can get off the substances they're on, and that's what this unit will be about. Patients will come here and then get into a position where they can benefit from the longer term treatments. I would say that we've been under planning for almost 7 or 8 months, and then we entered a period of construction And with all the activities going on here, you see the contractor trucks coming in. We have a great team that's building that unit out. The demolition phase for an area that was no longer used for clinical treatments and had moved to, one of our other hospitals became available for us to reconfigure. And so it's a real improvement. We've demolished the old walls and inward parts of what was a different type of service, and now the contract is getting ready to frame in and build out the modern technology that would go in a unit like that. And so we're looking towards the early fall for a completion date. It's so needed by the community that we're trying to get that into service just as soon as possible.
Absolutely. We see a lot of people going in and out of that area, and if you drive by our Washington Street side of the building, you'll see some construction apparatuses out there and some bins, and a lot of work going on out there.
Well, that's a good point, Julie, because one of the things that we have to do when we're working on a hospital that's functioning is make sure it's done in such a way that we don't disrupt any of our services for our patients. And, we've taken great precautions to keep the hospital looking as great as it normally does. It's a clean hospital, safe hospitals. And the contractors that we have really work well with us. They have the construction part that the public sees really limited to a small area of the hospital. And so we're working hard to get this completed. And towards the end of the summer, you'll see us really come to the finish line and hopefully have this unit in service by, very early part of the fall.
And now if you go up to the third floor of the hospital right now, does it sort of look like just an empty shell, and then you're going to start to actually develop the different rooms? And
So we've actually started to do that.
Oh, nice.
The rooms are being framed out. We took down a lot of walls and past finishes. We had to reconfigure it. We really want this to be contemporary and serve with the modern techniques of substance treatment. So if you were to go to the area now, you would see the metal studs for the walls framing the areas out. And very soon, in the next couple of weeks, we're going to do some fit outs behind, in the inner parts of the walls, and then we'll start framing in the rooms themselves. And there'll be, of course, a lot of electrical work, plumbing work. Healthcare is a team sport, and certainly construction is too. So we feel like we've retained the best and brightest to do this important work.
Absolutely, and I think you also had mentioned, we don't want to interrupt operations and patient care, and I'm sure with any construction, patient safety and staff safety is a big piece of that. So can you talk a little bit about that and
Sure.
what you have in place? And
Sure. In terms of Joint Commission standards that you mentioned, and I feel blessed to be a consultant for that organization. I go into hospitals all the time, and one of the areas of focus is a standard that has to do with performing demolition, construction, and renovation in a safe manner, because we seal the areas off properly. There's sticky mats for construction workers entering and leaving. We monitor the area. It's under negative air so that the impacts of construction don't migrate to other parts of the hospital.
And for listeners, what does negative air mean?
So we put these machines in that basically make the room negative, and we send air out of the room. So it's really pulling out and filtering any debris. This is the way to do construction in a safe and effective manner. And so when a construction worker leaves the zone, it's not pulling the air out, it's pulling the air from the surrounding areas in. And so that greatly minimizes the potential for infections or other potential negative impacts from construction and renovation.
Good morning. If you are just tuning in, where you're listening to a flashback interview where we were talking to members of our leadership team about building our new MORCAP substance use disorder treatment unit here at Morton Hospital. We are going to take another quick break, actually our last break of today's show, and we will be back to finish out that interview. Stay tuned.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
If you're looking for weight loss that lasts, look no further than the Stewart Center for Weight Control at Morton Hospital. Our program was recently nationally accredited, and we offer both medical and surgical weight loss options, as well as free support programs, all right here in Taunton. If you've struggled to lose weight, it may be time to consider weight loss surgery. Call our Center for Weight Control at 508-301-2434 to book a consultation.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning and welcome back to today's Morton in the Morning show. Today we are so excited to announce the official opening of our new MORCAP 32-bed Level 4 substance use disorder treatment unit at Morton Hospital, as well as an intensive outpatient program. We have been listening in to today's show to a couple of interviews that we did with members of our leadership team back in the summer when we were still building that unit, and we want to resume our interview with Tom of our facilities team, who's been talking about the MORCAP project as well as some of the other construction projects at Morton Hospital. So let's get right back to that interview. You know, you had mentioned that it's so important to upkeep the facility, but why else are these investments, what other reasons are these so important for hospitals, not just Morton Hospital, but hospitals in general?
So certainly you want a safe environment. Mm-hmm. So air systems, when you come to Morton Hospital, you're going to have air that is filtered properly, maintained properly. It's monitored for compliance on a regular basis. We have the Joint Commission come in and look, and the state health departments. And of course, our construction has to be done in guidance with regulatory standards. They ultimately approve it for opening, whether it's a machine on the roof to bring filtered and clean air into the hospital, or a new service, a new clinical service, mm-hmm. like the substance abuse treatment program that we're developing. But it's really important for hospitals to stay current with the facilities that patients come to. When you come into this hospital, we want you to be comfortable, safe, and be able to acquire your services with a proper patient flow mm-hmm. and staff flow. So as you probably see when you drive by hospitals, there's cranes and there's construction workers, and that's what goes into being a hospital, ensuring that you have contemporary facilities. And I feel so fortunate working here at Stewart, because we really believe in that. Mm-hmm. And here at Morton and the other Stewart hospitals, we have a lot of consistency from the system. Not only do I have a team in here that focuses on safe constructions, but we have a corporate group that makes sure construction happens safely through all the Stewart hospitals. And that's the kind of organization you want to work in.
Now, I know that you referenced also a couple times earlier that you're part of the Joint Commission surveyor team. So I'm not sure if the listeners, are familiar with the Joint Commission. We are very familiar with them here at Morton Hospital, yes. because we have a survey about every 3 years, so they can come in and take a look at our facility and the care that we provide. Now, tell us a bit more about Joint Commission
Sure.
and what the types of things that you look for as a surveyor in hospitals.
Yeah. So the Joint Commission really got formed in the 50s when medicine really started to get updated and regulated. And Joint Commission works on behalf of the government to come in and make sure that the hospitals, the surgeries are being done properly, the medicine is being done correctly and safely, nursing care provision of care is effective. But there's also standards about environment of care, that's the general environment, the physical environment, life safety, that means fire safety, and then emergency management. And as a Joint Commission consultant, I go to the hospitals all around the country, and in fact the world.
Yeah.
I've seen hospitals in many countries, and they all have the good intention of making a safe environment of care. But Joint Commission is the eyes of the to make sure that outsiders come in who don't live there every day and can look for evidence of standards compliance, which basically means, are you following the standards? And it's a job I love. I always say that being a Joint Commission consultant makes me be able to do my job here better, and doing this job makes me be able to be a better consultant.
And we learn a lot from you, from your experience, that's for sure.
Yeah.
How many Joint Commission standards are there when it comes to environment of care? Dozens, hundreds, thousands?
Yes, there's over 1,600 elements of performance, and that scans the whole gamut of provision of care, medical records, environment of care. But there's numerous standards having to do with the environment of care. A good example is there's a standard called hospital manages its utilities. So it wants to make sure that the government, and Joint Commission is the eyes that go out and look, the accrediting organization, make sure that the utilities are safe. Not only for patients but the staff too. And they check that to make sure there's a standard for staff knowing their roles and responsibilities in emergency events in the environment. So they wanted to make sure the staff can respond quickly to fires, potential fires, and other security incidents and all. And so I love doing that because I see the great hospital community in this country who work very hard day so hard to keep our patients safe and our staff.
Absolutely. Now, you said you've traveled all over. What has been one of your most interesting hospitals that you've gone to, anywhere in the country or internationally?
Well, I would say that that's a very interesting question, Julie, because I've been doing this for years. And I also do humanitarian work, so I see hospitals in, we have an organization called the American Medical Resources Foundation, and we donate medical equipment all around the world. So ever since for the last 30 years, I've visited to help the less fortunate. So I've seen that side of healthcare. I've seen very modern healthcare. Hospitals across the United States are working hard to make sure they have contemporary facilities. And then I would say in the international environment, they are working hard to catch up to, I would say, the domestic American standards. So I've seen large facilities built in places like Qatar. I've been in Lebanon where they're trying to modernize their facilities, Jordan, and so there's a real interest in I think it's really the industry. Everybody wants their staff to be safe. So I've seen there's a feverish amount of construction going on. I would say that the Joint Commission does a great job in making sure that if you visit a hospital in the United States, it's going to be really held to standards.
That's great. And I did want to touch on, to sort of round things out, the organization you spoke of, because one of the great things about upgrading our facilities here at Morton Hospital is when we make upgrades, we have equipment that's available that we can offer to others that may have a need for the equipment. So during COVID, we had a donation of some mechanical beds from the old Taunton nursing home.
Yeah.
And we were able to donate those. So tell the listeners about that.
So that's a great example. I'll start with the beds. Well, like I see our community as a human community, both in our immediate surroundings in the Taunton area and the United States and then the world. And I think that Stewart, having hospitals in Colombia and Malta, being a global healthcare company and an expanding company here in the United States that provides value-based care in a safe manner, It really warmed my heart to send 20 beds that were some of the older beds that we had because we're always modernizing facilities. And this is where I got the idea from in 1988. I had worked at a hospital and we were throwing out some medical equipment. And I said, this equipment could have another life. So I started a foundation called American Medical Resources Foundation. It's a Massachusetts nonprofit. So the Morton Hospital graciously donated these 20 beds to a hospital in Guatemala, and they were received. They actually arrived, and you could see it right on our website now.
Good.
There's an article
Have to check
with
that
myself and the hospital president, who's Heidi Taylor, who is, besides being a fantastic and modern CEO, she's, has a place in her heart for, as do others here, to try to spread the benefit. So those beds probably have patients in them right now. And those are very valuable for those countries. That particular country was hit hard by hurricanes, so the devastation in Guatemala was sizable. And then we had some regular lockers, just like you'd see in anywhere where people are storing goods. And actually, Julie, you were a big part of connecting us to a local place that takes care of the less fortunate.
Yeah, I think we've learned along the way, before we throw anything away, that there may be others who could use this. So it's been very nice to be able to donate those items.
Yeah, I think the lockers are special because we donated them today, and they're going to be in use for somebody who could really use it, as well as the beds.
Well, Tom, this has been very, very interesting. It's been nice to hear the perspective of someone who's been in this industry for such a long time, and thank you for the role that you're playing in overseeing so many important and exciting projects here at Morton Hospital. We're so fortunate to have, to be able to invest in these projects and grow our hospital for our community and for our patients. So, thank you.
It's truly a pleasure to work in this industry and to work for a company that's got the patient in mind, like Stewart.
Absolutely. Well, thank you for your time, Tom. We really appreciate you being here.
Okay.
All right, well, that was a look back at 5 months ago when we were speaking with Tom and Nancy about building our new MORCAP unit and the other exciting construction projects that were happening here at Morton during the time. As you can tell, they are ongoing. We are constantly growing, and we are so excited that this week we have finally been able to open our new MORCAP substance use disorder treatment unit at Morton Hospital. Again, I'll share the phone numbers, or you can find more information about our unit at mortonhospital.org. But for the inpatient unit, you can call 508-967-3200. And for the intensive outpatient program, 508-967-3838. Thank you so much for joining us today. We're so excited to offer this new service to our community, and thank you all for your continued support and for continuing to listen to Morton in the Morning. We look forward to joining you next week. Experiencing gastrointestinal issues? We can help. Morton Hospital and Steward Medical Group have opened the new Steward Digestive Disease Center of Taunton. Dr. Alexis Pappas and physician assistant Amber Lippa specialize in treating a wide range of GI issues and are now accepting new patients in their office conveniently located in the Thayer Building at Morton Hospital. To request an appointment, call 508-828-7740.